Why autism? Why not AIDS or cancer? The first patient with autism was first described in 1943. Hi friends, I'm Filip, a medical doctor and PhD student here in Croatia, and on this channel you can join me on my journey through medicine and science. I personally don't have children, but I imagine it's not easy for parents, especially with a firstborn child, to be bombarded from all sides, especially in the media, with all these claims about vaccines and autism. Of course, it's natural that parents want to protect their children, on the one hand, from the diseases which can be prevented with the use of vaccines, and on the other hand, from potential harmful side effects of vaccination. And regarding this topic, there's a lot of misinformation, which in my opinion mostly capitalizes on fear. And something which is often mentioned is especially autism. The first patient with autism was first described in 1943, whereas the vaccines for measles, which was invented in 1963, mumps, which was invented in 1967, and rubella, which was invented in 1969, and then those three vaccines were combined into one, called the measles, mumps, and rubella vaccine, or MMR vaccine, were invented or patented in 1971. In other words, autism is a disease which happens in nature and which existed before these vaccines were even invented by humans. Why autism? Why not AIDS or cancer or any other scary disease? This idea of vaccines being linked to autism came around in 1998 when a physician called Andrew Wakefield with his colleagues published the results of the research they performed. They examined 12 children ages from 3 to 10 years old, which were sent to a pediatric gastroenterologist, so a physician which deals in gastrointestinal problems of children, due to symptoms such as abdominal pain, diarrhea, etc. Aside from these gastrointestinal problems, all the children were first developing normally in terms of their mental function, and at some point started experiencing difficulties in mental development, such as problems in communication. Almost all the children were noted as having autism, and for the majority of them, their parents or their child's physician noted that the beginning of these mental development issues and difficulties started around the same time when they were vaccinated for measles, mumps, and rubella. So this group of physicians, led by Andrew Wakefield, did a series of tests and ultimately found signs of inflammation of the bowel in almost all of the children. Wakefield concluded that this inflammation might be related to the development issues in their mental function, which could altogether be caused by the MMR vaccine. Research such as this one is usually published in a journal, and the results of this research were published in one of the most prestigious journals in the world, called The Lancet. So imagine you're a physician or a scientist, and you read these results in the journal, and you ask yourself, what if this is true? What if the vaccine really causes autism in children? How would you, wanting to prove or disprove this finding with your own research, conduct your own experiment? How would you design it to test this hypothesis that vaccines cause autism, specifically the MMR vaccine? If you want, pause for a minute and think about it. So one thing we could do is look at 100 children which got the MMR vaccine and compare them to 100 children that didn't get the MMR vaccine, and in both groups count how many children developed autism. If the vaccine caused the autism, we would expect a lot more autism, a greater number of patients with autism in the vaccinated group than in the non-vaccinated group. On the other hand, if the vaccine doesn't cause autism, we would expect about the same number of children with autism in both groups, regardless of whether or not they received the vaccine. Another thing we could do is to take 100 children with autism and compare them to 100 children without autism and see, okay, in both groups, or in each group, how many got vaccinated and how many didn't. The percentage of vaccinated kids would be greater in the group with autism if the vaccine caused the autism, right? Whereas if it didn't, we would expect about the same percentage of vaccinated kids in both groups. There's multiple ways to approach it and multiple different research designs which are suitable to answer this question. In fact, since the publication of Wakefield's results in 1998, a lot of studies with different modalities and different designs were performed exactly with the goal of answering this question of whether vaccines caused autism or not. After a few years, with all these studies being performed, a group of authors took into account the biggest and the best studies performed and sort of united them into one article and presented these results. The total number of children which were included in this pooled analysis was over 1 million compared to Wakefield's 12 patients. To put this further into perspective, if you developed a new drug and you wanted it approved for use, you would need to conduct research on a few thousand participants, which is something I talk about in a linked video over here. And if you wanted to develop a new vaccine, such as the COVID vaccine, you would perform research on 40,000-50,000 people, whereas this analysis took into account over 1 million participants to answer this question. And all the studies included in this analysis found no link between vaccination and autism. This is further emphasized in the Clinical Practice Guidelines, which is a document put together by experts on recommendations as to how to diagnose and treat autism in children, where they reiterate that vaccination does not cause autism. If you're interested in the details, including the exact numbers and statistics, I'll link both of these documents in the description. One more thing to take into account from Wakefield's research, which is often quoted in one way or another, is that the beginning of the symptoms of autism occurred around the same time as the children received the vaccine. The key thing to appreciate here is that just because two things happen around the same time doesn't mean that one caused the other. To take a somewhat silly example, let's imagine that all of these children developed autism during winter months. Would that mean that winter caused their autism? No, it's simply something that happened around the same time. And this is precisely what is the nature of autism as a disease. The symptoms, the first symptoms of autism develop in childhood, which is also the time when we receive vaccines. So these two things happening around the same time in our life doesn't mean that vaccines cause the autism. It's a disease which happens regardless of vaccination in a certain number of kids every year. In fact, Wakefield's research was later retracted from the journal. It was revoked. The journal said, okay, we don't want this anymore because it's obviously incorrect. We have a ton of other studies which have proven that this isn't the case, and they decided to pull the article from the journal. Additionally, the Center for Control, Disease and Prevention is very clear about its position on vaccines not causing autism, and you can find more details on their website, which I will also link below. So coming back to the perspective of parents with a child, the risk from these preventable diseases, such as measles, mumps and rubella, is far greater than the imaginary risk of developing autism. So who can help parents make a better informed decision and thus better protect the health of their child, but a pediatrician who can explain the dangers and the associated benefits of vaccination. Hopefully, knowing the history of these claims about autism and how they were later scientifically disproven in a major way can enable parents to make a better informed decision and thus to better protect their child's health. Also, this would make them better prepared for the same situation with perhaps their next child. So I'm curious, what are you more worried about? The diseases which can be prevented through the use of vaccines, or the possible harmful side effects of vaccination? Let me know in the comments. Check out my video on antibiotics and don't forget to subscribe and hit the bell. I'll see you later.